illnesses, but also prevent them. Your actions restricting these vaccines have a grave impact on our country. And while you have waged war against established medical science, you've also attacked life-saving research on cancer and Alzheimer's. You have implemented measures that have raised costs, kicked families off their insurance, and made it harder to get coverage. You devastated rural hospitals. Look, to top it off, Mr. Secretary, I got a copy of H.R. 944. Do you know what it is? It's your impeachment articles, sir. You have abused your office, you have gutted America's public health, and you have sacrificed our leadership in medical research and innovation. Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You can smirk, sir, but I answer to the people of Michigan, and they have told me you should be ashamed, you should resign, and if you refuse, Congress should remove you from office.
Now recognize the gentlelady from Michigan, Ms. Stevens.
Well, thank you, Mr. Chair, for holding this hearing, and Mr. Secretary, it is in fact true. I come from the great state of Michigan, and as you enter your second year as our nation's Health and Human Services Secretary, I just had a few things I wanted to tick through with you here today. So in early 2025, after your confirmation, measles cases spiked in the United States to the highest level since 1991. Last year, we had over 2,200 cases in America. 3 people died. 2 were children. Do I have that correct? Because according to the CDC and the American Academy of Pediatrics, I do. During this same time,
that epidemic started before I came
during
into
this
office.
same time, you questioned the effectiveness of the measles vaccine. And then in September, your hand-picked vaccine panel voted against recommending the combined measles vaccine for children under 4. This is true?
It was dangerous.
We know now that over 90% of measles cases in 2025 were among people who were unvaccinated or whose vaccination status was unknown. That's correct? According to the CDC,
we should have given a dangerous vaccine that all the science
in just the first 3.5 months of 2026, the year we're in right now, we've already seen an additional 1,700 measles cases. I assume you're aware of this, according to the CDC.
There's a global epidemic.
You have also pushed vitamin A as a treatment for measles. That is correct?
Yeah, every
according
major
to
health
the America's
organization in the world
Poison
recommends
Centers,
it.
vitamin A overexposure among children increased by nearly 40%. And in this time frame, children in the hospitals with both measles and unsafe levels of vitamin A has occurred, correct?
I'm not recommending unsafe levels. I'm recommending what every major international health organization recommends.
The American Poison Centers agrees. You characterized your response to one outbreak in Texas as a model for the rest of the world, even as the number of measles cases climbed. As Secretary of Health and Human Services, have you ever taken steps to undermine medical guidelines rooted in science? Because we can look at your record, sir.
Oh,
I serve on the Science Committee. At the beginning of this year, the CDC tried to slash the childhood vaccine schedule from 17 recommended vaccines to 11 before it was blocked by a judge. Hepatitis A, B, RSV, multiple vaccines were demoted. Do you dispute this charge, sir?
You think that we should recommend interventions that have not been safety tested?
Have saved countless lives.
Congresswoman Haley Stevens sits with a rigid, perpendicular posture, her eyes locked onto Secretary Robert F. Kennedy Jr. with a gaze that is both evidentiary and accusatory. She uses her papers as physical weight, punctuating each statistic with a tap on the desk. In contrast, the Secretary's body language is a masterclass in adversarial detachment. He leans back, often slightly smirking or offering short, clipped interjections that suggest he views the Congresswoman's data not as fact, but as a narrative he has already debunked in his own mind. This smirk, specifically highlighted by Stevens at the end of the clip, is a vital observation. It projects a level of comfort in the face of tragedy that the Congresswoman characterizes as shameful. One of the most shocking revelations in this exchange is the sheer velocity of the measles comeback. Stevens notes that in the first 3.5 months of 2026 alone, The U.S. has seen 1,700 cases. This follows a 2025 where cases reached their highest levels since 1991, resulting in 3 deaths, including 2 children. Perhaps even more jarring is the discussion around vitamin A. Kennedy confirms he has pushed it as a primary treatment, while Stevens counters with the fact that hospitalizations for unsafe levels of vitamin A overexposure among children have spiked by 40% under his watch. It is a rare moment where a specific medical recommendation from a cabinet official is directly linked to an increase in poison center calls. Stay tuned and continue watching because this exchange moves from the specifics of measles into a broader, high-stakes legal battle over the very definition of a childhood vaccine schedule. You need to see how the secretary reacts when confronted with the fact that his department attempted to slash recommended vaccines from 17 down to 11 before being stopped by a federal judge. Also, if you value these deep dive breakdowns into the transcripts that the mainstream media often ignores, do me a huge favor and subscribe to the channel right now. It helps us keep the lights on and the analysis coming.
A 2024 study estimates that childhood vaccines have saved 1.1 million children's lives and prevented more than 500 million illnesses in the last 3 decades. Doctors, researchers, and medical experts have spent years working to not only understand illnesses, but also prevent them. Your actions restricting these vaccines have a grave impact on our country. And while you have waged war against established medical science, you've also attacked life-saving research on cancer and Alzheimer's. You have implemented measures that have raised costs, kicked families off their insurance, and made it harder to get coverage. You devastated rural hospitals. Look, to top it off, Mr. Secretary, I got a copy of H.R. 944. Do you know what it is? It's your impeachment articles, sir. You have abused your office, you have gutted America's public health, and you have sacrificed our leadership in medical research and innovation. Americans today are less safe under your watch. Children are dying of diseases that we thought we had eradicated. You can smirk, sir, but I answer to the people of Michigan, and they have told me you should be ashamed, you should resign, and if you refuse, Congress should remove you from office. I yield back.
The gentlelady's time has expired.
Stevens uses prosecutorial language, utilizing phrases like hand-picked vaccine panel, dangerous, and gutted America's public health. She frames the secretary's actions as a war against established medical science. Kennedy's speech, however, is built on interrogative deflection. He answers her data with questions like, "You think that we should recommend interventions that have not been safe?" This is a classic rhetorical loophole. By questioning the safety of established vaccines, he shifts the burden of proof onto the scientific community rather than defending the outcomes of his own policies. Looking at what isn't seen or explicitly stated in the brief sinks, there is a palpable sense of institutional collapse in the background. Stevens mentions that doctors, researchers, and medical experts have been sidelined, and that the CDC's credibility has been so damaged that a judge had to intervene to maintain standard vaccine schedules. This suggests a level of internal chaos within the HHS that extends far beyond a few contentious hearings. The mention of H.R. 944, the Secretary's own impeachment articles, indicates that the legislative branch is no longer just disagreeing with the executive, but is actively moving to sever the relationship entirely. The most intelligent observation one can make here is the reference to the global epidemic mentioned by Kennedy. He attempts to use the worldwide rise in measles to insulate himself from blame, but Stevens' counter-argument is that over 90% of U.S. cases were among the unvaccinated, directly linking the domestic spike to the Secretary's own questioning of vaccine effectiveness. It is a clash between the global trend defense and the domestic responsibility reality. Ultimately, this hearing ends on the most extreme note possible in a civil democracy: a demand for resignation and a threat of removal. Whether it is the devastation of rural hospitals or the demotion of vaccines for hepatitis and RSV, the loopholes Stevens points out suggest an agency that has pivoted from prevention to experimentation. What do you think? Should a health secretary be allowed to question established science if they believe they are saving lives? Or are these dangerous actions an abuse of office, as Stevens claims? Share your thoughts below, hit that like button for the algorithm, and subscribe to join our community of political analysts. This is the Melissa's Daily Report. I'll see you in the next video.